Hello, everyone, and welcome to the Arthritis Action Podcast. I'm Mark, as always, your host, and today I'm joined by Mercy Joy. So, Mercy is a physiotherapist and a researcher in the field of osteoarthritis, and she's here today to talk to us about how positive changes in your activity levels and behaviours can be beneficial to people living with arthritis. So, hello, Mercy.
Hello, Mark.
Thank you for coming today. I really appreciate it. So I've given a really brief introduction to you, and it's shorter than is justified, I'm sure. So if you could tell us a little bit more about yourself and your work with arthritis.
Sure, I can. I'm Mercy Joy, a physiotherapist with a background in orthopedics. My journey began in India, where I completed my master's specialization in orthopedics. And over the past 8 years, I've built experience in academics, clinical practice, and research. More recently, I came to UK to update and advance my expertise, completing my MSc in advancing physiotherapy practice at Coventry University. So this program is a blend of orthopedics, neurology, and cardiopulmonary, where this has given me a broader, integrated perspective across different specialities, which has enriched my ability to take a truly patient-centered approach. So, to talk about my passion for arthritis care comes from both my hands on work with patients and research. Have been part of collaborative projects on osteoarthritis, and my most recent focus is on patient education and exercise adherence. So, in other words, not just helping people begin an exercise plan, but supporting them to make a sustainable part of their everyday life.
Excellent. I mean, that lines up so well with what we do for Arthritis Action as well. Like when a colleague of mine introduced us and I said, "Oh, she does all basically everything you've just described." Then go, "Oh, well, that's a perfect fit for what we do here." So yeah, let's definitely get her on. Let's start off with a little bit about arthritis, and then we'll kind of lead it into what we've been talking about. So, I mean, how does arthritis affect someone's lifestyle?
Arthritis isn't a single condition. It's an umbrella term covering over 100 different joint disorders,
Hmm.
so including rheumatoid arthritis, osteoarthritis, psoriatic arthritis, ankylosing spondylosis, gout, and more. So each one has its own quirks, which has an impact on daily life, often shares common themes. So pain is perhaps the most obvious symptom, but it can be a complex mix. Sometimes it can be acute, coming from actual tissue damage. Other times it's more chronic, arising from ongoing inflammation, changes in how the nervous system perceives pain, or the psychological stress of living with long term condition. So these factors tend to interact, each amplifying the other. So think of your joints like the hinges on an old gate. If they are rusty, the gate squeezes, gets stuck,
Hmm.
or moves unevenly. Arthritis is a bit like that. Every joint movement can feel resistant, making tasks that used to be simple suddenly tricky. So, like walking to the shops, climbing stairs, or opening your car become daily hurdles. Over time, reduced mobility can lead to deconditioning, loss of strength, and decreased independence. The effects aren't just physical. So research consistently shows that arthritis can have influence on mood, confidence, and social engagement. So persons may experience frustration, anxiety, and even withdrawal from activities they once enjoyed. So I would like to say one of the person whom I'm treating with arthritis used to tell me that she feels bad and get into parties. And even so, if she wants to go get into there, she wears a long sleeves, long dresses just to cover her swelling around the joint, the redness, and everything.
Hmm.
So keeping them away from those social activities which are really so daunting for them. So any activities like gardening, playing with grandchildren, or attending community groups, anything may be difficult. Or so in other words, arthritis can impact identity, relationship, and overall quality of life. It's not just the joint, it's the overall quality of life. So that's why modern NHS care emphasizes a whole person approach. It's not to treat the joint alone. Successful management combines medical treatment, physiotherapy, lifestyle support, psychosocial interventions. So, aiming people to live well, stay active, and maintain independence despite the challenges of arthritis.
Yeah, it affects everything, doesn't it?
Yes, yes, yes.
I think when most people, when they just, I suppose maybe those especially who don't have arthritis or don't know someone with arthritis, they'll probably just think like, oh, just mobility, that's it. But it's so much more than that, isn't it?
Yes, yes. So when we talk about in a broader aspect about the biopsychosocial point of a chronic disease, so it affects not only the biological tissues, but as well as uh, the social participation, activity restriction in participation in activities. So all that combines, which will have a effect on their quality of life, what they live. So it would be different from what they were before and what they are experiencing right now.
Definitely. Let's move on to like what would the impact be, say, for example, on someone's mobility or their ability to exercise?
So arthritis can affect mobility and ability to exercise in a variety of interconnected ways, making daily movements feel like a challenge. So, firstly, pain in arthritis is complex. It's not just a matter of wear and tear. So, chronic pain often involves ongoing inflammation, changes in how the nervous system perceives pain, and the psychological stress of coping with long term conditions. So these factors interact and amplify discomfort, sometimes making even gentle moments feel daunting. So the next one would be fear of pain or worsening the condition is more common. So they think this moments may worsen my condition. So take hand arthritis, for example. Many patients avoid gripping or using utensils or lifting objects because they anticipate pain or damage. While this is understandable, this avoidance can paradoxically reinforce stiffness and weakness. So therefore, reducing functional mobility over time. So, persistent pain can also rewire neural pathways, so increasing sensitivity and sometimes encouraging unhelpful coping strategies. So, like I was already mentioning about the withdrawal from the participation wise, so it's
Mm.
also withdrawing from exercise or ignoring healthy movements. So, this muscle guarding effect can compound mobility and issues. So, reduced activity carries furthermore consequences. Immobility can lead to muscle wasting, joint stiffness, poor cardiovascular fitness on a longer term, and even high in pain. So, a viscous cycle where avoiding movements makes daily tasks harder. So, it's important to understand that pain isn't always a reliable indicator of just the joint damage. A painful joint may still tolerate gentle, controlled movements, and in fact, movement is often protective. So think of joints as hinges. Letting them stay still makes them stiff, but careful use makes them functional. So, and also like on mental health, it plays a major role on mental health, anxiety, low moods, depression. So common among people with arthritis. So further limiting mobility. So evidence shows that combining physical activities with psychological support can improve both movement and quality of life. So ultimately, encouraging safe, guided exercise, education about pain, and confidence building strategies are keys to break the cycle of avoidance and building people maintain mobility.
Okay, great. So exercise is definitely the answer then.
Yes, yes, of course.
Everyone who listens to this or has ever worked with me in any form knows that I will constantly bang on about that one and will always be saying how everyone needs to be doing as much as they can. Not necessarily always doing more. That's the phrase I always like. It's like do as much as you're able to do. There's no
Yeah.
set limit as to what or minimum that you have to do. It's whatever your body's able to handle.
Yes, that's correct.
So, I mean, what type of changes do you think then people should make to start moving more? Because like we explained like how it's really important that they do, but how do they start to do that, especially if they are in that deconditioned cycle where they've kind of done nothing for a long time? What changes should people make?
That's really a very important question to address. So we talk more time we talk about exercises as medicine, but how to get started. So to get started, you don't need to have a gym membership. You don't have to be a gym bone. Just simple everyday adjustment can make a huge difference. The key is to start small, build confidence, and weave movement into daily life. So, first, you need to believe that relief is possible. So, the mindset matters. So, many
Mm,
people avoid activity because they fear pain or damage. So, it's very important to understand that gentle guided movement is safe and can be empowering. It's like just or small steps, a very small steps that matters, or incorporating movement into your daily activities. So movement don't have to be a separate church. Try walking while on a phone, stretch while waiting for a kettle to boil, doing calf raises while brushing your teeth.
mm,
So evidence shows that movement snacks of just 5 minutes several times a day adds up. So start small, progress gradually. So begin with short bouts of activities that feel manageable, then increase the duration, intensity, or complex over time. For instance, a patient might start with a 5 minute walk around the garden and then progress to a 10-minute stroll around the local park. Or and to get started, another important thing the person can do is to seek professional guidance. So you can get your GP or a physiotherapist and ask for a supported exercise program. So to tailor a program for them, a personalized exercise program. So they would help in analyzing the psychometric assessments, do the psychometric assessment on you to find out the fear or how low you are, or the anxiety levels, and tailor the program according to you. So the message is simple. Small, consistent, and enjoyable changes to daily routines can build moment, restore confidence, and help people reclaim mobility without overwhelming themselves.
mm. I think a phrase sort of I've used sort of several times is like, if you have arthritis, kind of you're in it for the rest of your life now. So there's no rush to achieve everything all at once.
Yeah.
Just like, as you say, small but small like movement snacks as well. I love that phrase as well. My colleague Martin has a program that he called Movement Snacks as well, which we'll put a link to in the description because it's the same type of thing that you're talking about, Mercy.
Sure.
And yeah, just doing little bits, it makes such a difference. And I think there's such a misconception that if you do exercise, it has to be like that 45-minute, an hour long session, but it absolutely doesn't. There's no reason it has to be so rigid and formulaic as that.
Yes. So just starting small, that is more fine and enough. Or just listen to your joints, what they say. It's not like you may think that a rest would be beneficial for you at that time. So in a longer term, your joint will say, just wake up, walk around, move around. I need some fresh air to move about. So do it. Just listen to your joints. It will tell you to move.
Absolutely. So I mean, like, how can people get started into employing this into their life?
So getting started is often the hardest part. So it's a bit like taming a beast that's been quickly holding you back. But once you take the first step, momentum builds. So the first step. So as I've already mentioned, the first you can just go with a professional advices, because tailoring a personalized plan which involves your daily routine, your schedules, and at what level of arthritis you are in. So what are the self management you've already done, and what is your level of exercise, your capacity. So all this can be identified, and a safe, suitable exercise, suitable intensity, and any adjustments to your schedules, all thing can be done. And you can build social support. So joining support groups or finding peers who understand what you're going through can make a huge difference. Even asking family members to join you for walks or gentle stretches can help you out in that, doing an enjoyable activity. So start slow and keep it enjoyable. So choose movement that feel comfortable and enjoyable. So gentle stretches, a short walks, low impact exercise, or good for a start, a low impact exercise. You don't have to think about running a marathon at the very first. So start with very low impact exercises. The key is to focus on consistency, not the intensity. So just be consistent in what you are doing. Set small, achievable goals. Setting goals is very important, so that really motivates you. So rather than thinking about running a marathon on day one, just set realistic targets like 10 counts of sit to stand from a chair when you're about to move, around 2 minutes of stretching during your TV breaks, like that. So you can just set small goals. So it's mandatory to celebrate each success. Small wins build confidence. So celebrate very small wins.
Yeah, people need to pat themselves on the back more and
Yes.
celebrate. Doesn't
Yeah.
matter how small it is, you've
Yes.
achieved something. You should really, really celebrate.
Yes, you have a
Yeah.
your joints will bless you for that, and incorporate movement into your daily life. So think exercise of as a part of your routine, not an extra task. It should not be a burden to you. So
Mm.
stairs instead of lifts, stretching while waiting. So gardening, all can all count. So the aim is to make movement habitual, enjoyable, and rewarding.
Absolutely. I couldn't agree more. I think it's one of what's it? What's the word for it? My kind of mantra is always like, to take the stairs. I describe myself as a take the stairs type person.
Yeah,
Much
yeah.
to my wife's despair, because she would just like, can we just not? And go, no, no, that's the way we'll walk it. It'll be all right. I'm always like that. I like to do it. Obviously, there's limits depending on what everyone can do.
You can just try at least a few stairs, then get back down and then go to the other. Something you can just make it short. Just trying it is not a problem in that. So just try new things, which you will try enjoying it. It's not you don't have to climb all the four floors at once. So you
Mm.
can for the start you can make only one floor for today, and then gradually increase to the other floors. So making a progress like that would be much fine.
Definitely. As we've talked about, like people getting started and everything, I suppose motivation is going to be a really big aspect of this. And I know that's one from so many people I've spoken to through this charity is motivation is their hardest thing. Again, I know we've talked about getting started, but getting motivated to do it continuously, because consistency is so important with exercise. Probably my number one is just be consistent about it and you'll get better or better at what you're doing. And so, how can people motivate themselves?
Well, it's important not to mistake lack of motivation for laziness. For many people with arthritis, it reflects genuine psychological stress caused by changes in neural pathways due to chronic pain. So the brain itself can become wired to avoid movement because it associates with discomfort. So how can we just come out of this is retrain your brain. So exercise can help create new positive neural pathways. So starting small achievable goals and gradually increasing activity helps your brain learn that movement is safe and even rewarding. So think of it as reprogramming an old computer over time. New healthier habits can take over. Use positive self talk and mindset shifts are very important. So encourage yourself with phrases like, I can do this, or a few moments help my joints. Adapting a new mindset often leads to new results. So each new small reinforces confidence and capability. As I've already mentioned, celebrate small wins. So motivation grows with progress. It's all a cycle. So you exercise, you get motivated, you do it again, you repeat it. So the starting is start small, but we have to understand that it's not an habit. They have become habitualized to this being non-motivated. It's really a genuine neural pathway or discomfort that's happened in the neural pathway. So pair exercises with enjoyable activities or social groups. So in short, motivation is a skill that can be nurtured, not just a fixed trait. With the right approach, support, and small success, people can gradually build a sustainable, active lifestyle.
Lovely stuff. I mean, so that's, I mean, yeah, I'm agreeing with everything you're saying. So I suppose the next step of that would be in that kind of like journey of starting to get more active is once you kind of like started doing it, how can people keep on track and keep on exercising? Because obviously, so I mean, let's use January is always a good example. I remember this from my time working in gyms. It's absolute chaos. It's so busy. Everyone's desperate to exercise. They all want to do stuff. But by the time you've hit March, the place is empty again.
Okay.
So,
Yeah.
because everyone gives up and they all start off with
Yeah.
the greatest intentions and it's going well. but staying
Yes.
on track is really hard work. So what do you recommend for people to keep up what they're doing?
Yes, yes. So first understanding that staying active isn't just about perfection, it's about persistence. Even the most motivated person will have days when life gets in the way, illness, holidays, or even simply fatigue. The key is not to beat yourself for missing a session, but to restart the next day. Think of it like tending a garden. If you miss a day of watering, the plants don't die. They just need attention again.
Hmm.
So, likewise, treat activity like an appointment. So now we have started yours. We did see how we are going to get started. So we have started. So once you have started, and for a few days, make it like an appointment. Schedule your walks, schedule your stretches. That would be more helpful. And have a buddy system. Having a friend or a family member, a peer group, can make exercise more enjoyable and harder to skip. So you cannot give excuses.
Absolutely, yeah. Accountability is really big, isn't it? 'Cause
Yeah.
if you're supposed to meet someone to go for a walk,
Yeah.
you can't just go, "Oh, I can't be bothered today."
Yeah.
Yeah, if you do it, if you don't go, you'll feel, "Oh no, I'll be ruining their walk as well." So I have to.
Yes. Yes, that's correct. And getting engaged with local support groups, NHS or community-based arthritis exercise groups, where Arthritis Action has group, and keep a journal or a tracker. We usually advise the people with arthritis to have an exercise logbook, so where they log their activities, steps, their progresses, their reinforcements, accountability, and lets you celebrate achievements. So when you get back to your review, you can just show that to your GP or physiotherapist, where you'll feel rewarded, and or reminders and cures. Of course, we really get busy in our daily work. Most of the time, people say there's lack of time. So reminders and cues, so phone alarms or calendar prompts can help you maintain a routine, even during your busy weeks. So consistency matters, but persistence is even more important. I would say persistent is very important. There's a
Okay.
difference in consistency and persistence because we get setbacks. So coming out of it is more important. So life will occasionally interrupt your routine, and that's okay. What counts is getting back on track, maintaining the momentum, and enjoying the journey towards strong and more flexible joint. So that is what it's about.
Excellent. Oh, so yeah, so I finally I've been corrected, which is good. Yeah.
No, that's correct. That's we really motivate our patients to be
Yeah.
more persistent. It's not all the days are the same for all. It's even
It's
a
yeah.
very, very
It's a very good point because I suppose, especially with something like arthritis, like if you have rheumatoid, for example, and it's really flaring up that week, like it could
yeah,
just be. I mean, at the time of recording this, it's very hot outside, and I know some people where that's going to blow them up like in their words, a beach ball. Not my
yeah,
words. That's how they describe it. They blow up like a beach ball in the
okay.
heat. So exercise is going to be tougher then. But again, it's like again that I suppose persistence, as you say, make sure when they are able to do something again to
Yeah,
make
yeah.
sure they do it then.
Getting back on the track is very important. It's okay to go off, just get back.
Mm.
It's okay.
So, at what point do you think people should speak to someone like from a medical background about exercise and arthritis?
So, for an initial, when they are more confident during the early diagnosis, so people will get advices from their GP or the physiotherapist. So following that routine is fine. But what happens is when people don't get time to do exercises daily, and they skip their movements, so that's when during their flares, that's when the joints gets a bit worse. It speaks up. It says, "No, I'm very tired of doing things and all." So when they feel a prolonged fatigue, so when it's really hindering their daily like activities, their daily works which have already there, it seemed to be easy for them when they're not able to do that right now. I think that's the time they have to seek medical guidance.
Okay, I guess there's always a lot of listening to your body, isn't there? Because
Yes,
even though,
yes,
like, even if you have a really stable routine, you might just
yeah,
have a day where, like, my arthritis is
yeah,
absolutely not having this today. So
yes, yes,
take that day off, or do something even more gentle than you were planning,
yes,
so
yes,
that
of
you can do it
course.
properly another day.
Yeah, yeah, the next day. Not at all long gap, but
Yeah, not in like 6 months, in like
yeah,
a day or two.
Yes,
Oh yeah,
yes.
it happens to me as well. I'm on it was last Friday. I planned it. I had one more thing on my list I wanted to do of like workouts for the week. I did
Okay.
10 minutes of it and it was just warmed up. I was trying to warm up. I just couldn't get
Oh,
there. So it's like,
okay.
because I've got it on my back, so I'm always a bit cautious of it. I thought like my
Yes.
back is just not warming up. I'm abandoning this today. And I just decided not to bother and tried it again on Monday.
Yeah.
Give
Yeah, that
my body wants a rest. I'm going to give it a
yes.
couple of days off.
Yes, your body tells you, and when it really wants to rest, it tells you. So you
Mm.
just rest. You don't have to think much, overthink much, and get exerted out of it. Just a rest is fine.
Yeah, I think that's an acquired skill that you learn that over time as well. So I guess for anyone who's new at starting that type of thing and you don't know where that point is, unfortunately, it kind of is trial and error because
Yes, yes. Or the facilities here. So when we are not able to have a routine checkup with our or a GP or a physiotherapist, we don't get appointments. We're on wait, so that is when all this happens. So having a self-management strategies, having your exercise tailored well before, and having the schedule with you, often try those things, and then getting back for a review. That would be more fine, as you told. Yes, keeping that on a track, that would be more fun.
yeah, so we've been talking quite obviously around a physical standpoint for all of this because a lot of it is about physical activity. We've touched on this, but it'd be good to talk a bit more about changes in mentality as well, because obviously some of this is habit forming or behavior change. Like, so what kind of mental changes or change their mentality do people need to make, and how do they do that?
Yeah. So, changing how we think about movement is just as important as the exercise themselves. So, arthritis can create unhelpful beliefs about pain and activity, which in turn affect motivation and behavior. So, behavioral approaches. So, I really use the cognitive behavioral approach principles. So while I tailor the exercise to the person with arthritis. So cognitive behavioral approaches can help reshape these patterns. So unlearn pain related fear. Many people assume that pain always signals damage. So in reality, gentle guided exercise can be completely safe and even more protective. Think of your joints like an elastic band. Gradual stretching strengthens them rather than tearing them. So, or overcoming the negative thoughts. Cognitive reframing. So, I would say that is more important when we think in terms of psychological aspects. So, replace unhelpful thoughts with realistic positive ones. For example, you're just thinking exercise will wear out my joints. So replace that thought with safe, gradual exercise strengthens muscles and supports the joints. So this exercise is going to support me. Or
Mm.
sometimes we talk to ourselves, pain means I'm damaging it, I'm scared of it. So just replace that with some discomfort is normal and safe during rehabilitation. So just reframe your thoughts and retrain the pain system. So persistent pain can alter neural pathways, which I've already mentioned. So
Mm.
all these are the reasons for the psychological distress. So creating fear avoidance behavior, which will do that. So structured activities help rewire the brain, teaching it that movement can be safe and beneficial. So classical conditioning and repetition are key here. Over time, the nervous system adapts and adopt positive coping strategies. So focus on participation rather than perfection. So celebrate small wins and progress rather than aiming for flawless performance. So we are not into that right at the start. Okay. So gentle encouragements, goal settings, and reinforcement help make a moment a positive habit rather than a source of anxiety. So, in short, mindset matters by challenging unhelpful beliefs, retraining the pain system, and adapting realistic, positive coping strategies. People arthritis can move more confidently and reclaim control over their bodies.
Is there any help available for people to kind of achieve this? Because obviously, like, everything you're saying makes sense, but some people always need a little bit more help. Is there anything available out there for people?
Yes, it's understandable to feel overwhelmed by the wealth of information online. So it's important to focus on trustworthy and evidence-based resources.
Mm,
So seek professional guidance, talk to your GP or physiotherapist or any other healthcare worker, your psychologist, your nutritionist. Anyone can have a personalized plan for you. So can provide a personalized advice, helps design safe exercises, and look on to evidence-based resources like NICE guidelines, NHS resources, and or websites. So the Arthritis Action website.
of course,
And
yeah, yeah. That's everyone's first port of call, of course.
so yeah, it provides practical tips, exercise plans, and patient support information. And honestly, other community supports, so local support groups or exercise classes offer which offers peer encouragement, social connection, and practical guidance. So the key is to use reliable resource, seek
Mm,
support early, and take small, manageable step towards an active, fulfilling life with arthritis.
excellent. Brilliant. So, I suppose what one last thing then, I suppose, and then I will let you go because, yeah, that's all been excellent. But any final tips or any little words of wisdom or anything that you wanted to throw out there for anyone?
Okay. Arthritis may slow us down, but it doesn't have to stop us. Every small step, stretch, or moment is a victory. So, by reshaping our thoughts, retraining our mindset, understanding our joints, starting gently, celebrating each small win, and using support wisely, we can reclaim mobility, confidence, and quality of life.
Wow, excellent. Great. Oh, great stuff. Oh, we'll end on that one because that was brilliant. Brilliant. So thank you so much. And if anyone wants to, learn a little bit more about some things we talked about, there's some links in the episode description below, including our website and an email address as well. Should you want to ask us any more questions or suggest, any other topics or anything you'd like to hear, please don't forget to like, subscribe, rate the podcast or wherever you're listening to this or watching it. And yeah, get in touch with us if you have any other questions. We'd always love to know what people have to say. And Mercy, thank you so much. That's been really interesting. I've really enjoyed that.
Thank you. Thank you, Mark. You too. Bye.
Great. And thanks everyone for listening. Bye bye.